Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Hello, fellow healthcare leaders, and welcome to Season 2 of the Chaos Whispers of Healthcare podcast. I am so incredibly excited for you to hear from this season's star-studded guest lineup. Looking back at Season 1, I have realized how much U.S. healthcare leaders need to have safe spaces for brutally honest conversations. We don't always have that at work because we want to be as professional as possible. But we also need to be able to process the traumas, the triggers, and this insidious culture of martyrdom through exhaustion that seems to have become this accepted version of normal for us. When I say culture of martyrdom, you might be wondering what that actually means. Well, for starters, we know we have the most expensive healthcare system on planet Earth. We are the most expensive by a landslide, and yet we have some of the worst clinical outcomes in the world. Our healthcare system in this country is broken, but it's not by accident. It's by design. It's designed to keep running exactly as it always has. And disrupting it will require massive cultural change by the leaders and clinicians living in it every single day. The expectation for those leading in this broken system, and that includes you, dear listener, is that we sacrifice our own mental and emotional well-being on this altar of exhaustion. Now, no one says that out loud, but their reactions to boundaries and our time outside of work speaks louder. This is not just my opinion, by the way, it's factual, and there are several leadership studies with the data to prove it. In one 2023 study of U.S. healthcare leaders, over 70% of those leaders reported feeling completely burned out, and over 90% agreed that it's negatively impacting their organization. The 2024 Nurse Leader Insight Survey showed that administrative overwhelm and staff turnover are top barriers for them. Healthcare leaders have been sounding the alarm for years, but we have yet to address the root causes. The impact of leader overwhelm and burnout spills over into our clinician workforce too. We know there's a large exodus happening within nursing in this country. While some are due to retirement, there's an even bigger portion under the age of 35 that are leaving the profession completely due to the working conditions they face. While we know about best practices to address that crisis, leaders struggle to implement them because they themselves are stuck in survival mode. If clinicians rarely see their leaders because they're stuck in back-to-back meetings or firefighting, they assume their leader doesn't care about them. And we know that's not true. But it begs an important question. How do we get healthcare leaders protected time to focus on what matters most, their teams? I experienced this as a manager, a director, and as a hospital exec. I lived through the pandemic chaos, and I experienced some of the harshest work environments I could have imagined. But I also experienced the transformation of simplifying my work and getting back protected time so I could bond with my team. No one teaches us how to do this. Many of us figure it out on our own and through trial and error. We know it's possible to be able to disconnect from work, to be fully present at home and drive outcomes that keep our patients safe. But that requires intentional strategy, and we have to believe it's possible. This is the heart of what I call the Chaos Whisper movement. This movement is for any healthcare leader who is done with burnout, wasted time, and overwhelming workloads that keep them from their teams. This movement is centered around this key concept. You are not meant to earn your worth through exhaustion. And yet the opposite has been true for too long in healthcare leadership. So what do we do about it? First, the Chaos Whisperer movement gives very practical tools and tips for leaders to use at work right away. Now, I have a great deal of respect and admiration for my peers who give high-level presentations on theoretical frameworks and innovative pictures of the future. But I don't see many people giving us the practical steps to get there. Do you? We absolutely need both. We need to be able to feel inspired and energized, to hope for a brighter future. But when most leaders are stuck in survival mode, they can't reach those higher level ways of existing. So the Chaos Whisperer movement gives us the tools and steps we need to get out of survival mode so we can thrive instead. We just have to have the courage to speak up and take that first step. We cannot continue to silently accept current state just because we don't know where to start. Silence allows the current state of leadership in healthcare to continue as it always has. So let's break the silence and start talking out loud about what we're facing, how it's impacting us, and most importantly, how to move forward in a better way. Season 2 of this podcast is meant to be a love letter to each of you. These guests are here to talk about the very pains you face every day at work. We talk about bullying, not just for direct care clinicians, but leader-to-leader bullying too. We are going to cover the harshest realities of mental health struggles, overwhelming workloads, burnout, how to future-proof your career amidst rifts and role elimination, and so much more. Every episode will have an expert provide at least 2 practical strategies you can use at work right away. In fact, all of the practical tips from season 1 are available in a single document on the podcast website for you to use. Because that's the goal with this movement and the podcast, to help you walk into work empowered with new ways of removing noise so you can show up as the leader you know you're meant to be. I am so honored and excited that you chose to hit play on this podcast today. I hope you find all of these episodes to be helpful and encouraging because you deserve it. You deserve to lead in a healthy work environment where people are seen and valued at every level. That is what will heal this broken system. And we can do this together one step at a time. Cheers to all of you fellow Chaos Whisperers. This season is going to be absolutely incredible. Thank you for what you do every single day, and I'll see you inside the next episode. Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.